Okay, welcome back, everyone. It's Dr. Lindner. We are still on the GI tract. Let's talk about a hiatal hernia. So, a hiatal hernia is when there's a protrusion of the stomach through the diaphragm, right? So, if here's the esophagus, and here's the stomach, and then here's the small intestine, and then here's the large intestine, and then here's the anus, the diaphragm is this muscle that goes like this. All right, there's this little hole right here through the diaphragm that the esophagus goes through. So when you get a pouching of part of the stomach above the diaphragm, that is a hiatal hernia. So here's the stomach, and you can see part of it protruding up. Here's another one, part of it protruding up. Now remember the dangers with this. This is the diaphragm, and this is the diaphragm, and that's the stomach, and that's the stomach. They're both protruding upward. Remember, the stomach has parietal cells, and the parietal cells make hydrochloric acid, and they make intrinsic factor. And we also have chief cells, and the chief cells make pepsinogen. So when you have parietal cells here making hydrochloric acid, if those cells are here, guess what this person is going to feel in the throat, in the esophagus? Heartburn. Okay, so they have to do a surgical procedure to pull this down. In old school, there used to be doctors of chiropractic and doctors of osteopathy uh, and some MDs, but mostly the DOs and DCs would apply more holistic measures, but they would have a patient that has this stand on a chair, a table, and then have them jump to the floor. And when you do that, think of what's happening mechanically is your body is dropping down fast with gravity. When your feet hit the ground and you stop, guess what's happening to all your organs inside of you? They still tug down. And they used to use that as a quick, very fast way of trying to get that to drop down to get the patient relief. A lot of osteopaths do visceral manipulation to try and manually pull that down. Sometimes it works, sometimes it doesn't. So the symptoms of a hiatal hernia, they're going to get gastroesophageal reflux disease. They're going to get substernal pain, right? That burning right behind the heartburn, but they also get back pain, and they get something called dysphagia. Dysphagia means difficulty in swallowing, difficulty in eating, that type of thing. Dysphagia. The causes of hiatal hernia: heavy lifting, obesity, pregnancy, wearing tight fitted clothes, and it can also be congenital. So, what's the therapy for it? Well, avoid all the causes of stomach cancer and esophageal cancer. You can invert the bed without pillows, avoid heavy lifting, avoid tight clothing, decrease weight, and you can decrease the size of the meals, just increase the number of the meals. Instead of eating so much, eat less, but just eat more frequently. Okay. Now, stomach ulcers, I'll talk about in just a second. We'll be right back.